And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.
Okay. Hi, everybody. Welcome to Keeping It 100. My daughter just told me something and just threw me off. But let me pull myself together. I'm back. Welcome to Keeping It 100, where we have these open and honest conversations to make sure you have all the information you need to make good quality health decisions for yourself and for your family. I'm Dr. Kristin Motley. And as always, we have a really good show in store for you. If you think of questions, pop them in the chat. We will make sure they get answered. Let me bring in the street practitioner himself, Mr. Georgie Mink Jr.
Excuse me. How you doing?
What's up?
Hey, Doc. What's going on?
How you living?
I'm great. I'm in the building. How you doing, Doc?
She is in the building. I'm good. You know, I actually went away this weekend. We had a little weekend excursion to Brooklyn.
Nice.
My first time going to Brooklyn and staying for a couple of days. Black Brooklyn was everything.
Wow.
It was nice. We had a really, really good time.
Wow. Nice, Doc. Okay.
How about you?
I had a great week.
You doing anything?
Yeah, I had a great weekend. It just was simple and plain, you know. Yeah, great. I didn't go to Brooklyn. I didn't leave the state. I didn't leave the block, but it's cool. I just got some rest, and
that's important.
You know, right.
That's
but yeah, Doc, how you feeling though? You good?
I'm good. Thanks.
Nice.
Thanks. I'm ready. I'm good and ready.
I'm ready with you.
Let's hop right into, speaking of Black Brooklyn, let's hop right into our Black History moment.
Oh yeah, that's
with the street practitioner.
Okay, that's on
What you got for us this week?
All right, so I got a great lady, great woman. You know what I mean? I'm getting ready to turn my camera off so we can get her picture up. And we're going to honor Jane Cook Wright. She was born in 1919. She passed away at 2013. She's the daughter of one of the first Black American graduates of Harvard Medical School. Jane Cook Wright, she grew up with an avid interest in healthcare. Her father, Dr. Lewis Wright, was also the first Black doctor appointed to a staff position at Municipal Hospital in New York City. And in 1929, the city hired him as a police surgeon, the first African-American to hold that position. After earning her medical degree, Dr. Jane Cook Wright worked alongside her father at the Cancer Research Foundation in Harlem, which her father established in 1948. Together, father and daughter researched chemotherapy drugs that led to remissions in patients with leukemia and lymphoma. In 1952, when her father died of tuberculosis, Wright became the head of the Cancer Research Foundation at age 33. Wow. She created an initiative technique to test the effect of drugs of cancer cells by using patient tissue rather than laboratory mice. She advanced to work as the director of cancer chemotherapy at New York University Medical Center, and she was an associate dean at New York Medical College. Wow. And she's very important. The New York Cancer Society elected Wright as its first woman president in 1991. Her research helped transform chemotherapy from last resort to a viable treatment for cancer. Wow. So major, Doc, major stuff.
That's incredible. And I was reading about her when you sent me her name. Her grandfather is also one of the first African-American physicians in the US too. So she comes from a line of people, dad and grandfather and herself, who broke barriers for us and for people like us to, do work in healthcare. And it's just really incredible. Really incredible. You're on mute, Jay.
Yeah, because I had a lot to say about her. I was amazed that she was a part of chemotherapy, like the process way back then. Yeah. I didn't know like that's crazy that she even was a part of that whole movement, or just the process for chemotherapy way back then. So wow, man, we big, Doc. We big, Doc.
We've been doing big things. Yeah.
She was a female doctor. So listen, Doc. So kudos. You gotta give her props today, Doc. You gotta give her
absolutely.
Yeah.
Let's give her a hand.
Did good on picking this one too, Doc.
What you say?
I did great on picking this one. She was a great one.
Oh, you always do good.
Yeah.
That's why you in charge of the Black History Month moment.
Yeah, you know.
Because I know I could count on you.
You next, Doc. You next up.
That's all good. That's all good. But yeah, so I really thank all of the people that paved the way for people like me and us to, become healthcare providers, because there was a time where we could not go to school to become physicians and pharmacists and nurses. They wouldn't let us in their schools. And so it took a lot of resistance. I know that the theme for this year's Black History Month is Black resistance. It took a lot of resistance from people in our community, from people who supported our community, for us to get to where we are today. We have a lot to do. We have a long way to go to bring our numbers up in terms of Black healthcare providers. But, we're going to get there, and we're going to get the work done. And I'm just really grateful for everyone that broke down the barriers to allow a path for me to do the kind of work that I do, and for us to be in the community and helping and serving. It's incredible.
Yes.
Very unfortunate. So thanks for bringing attention to her story, to her family, to their contribution, especially to cancer. We know that African Americans die at higher rates for certain cancers. And so their advances, their discoveries, I'm sure have been improved along the way. And it's really made a difference in our lives, in our community's life.
Yeah, definitely, Doc.
Awesome. Good pick.
Yeah,
good pick,
so.
Jay.
Yeah, wow. Oof.
So we're also honoring American Heart Month, and I want to remind you all that heart disease is real. More Black people die of heart disease than any other race, so we have to take this seriously. And for a lot of us, it starts with having high blood pressure. High blood pressure doesn't have any symptoms. You have to get your blood pressure checked to know your numbers, and so that's really important. When we think about COVID in terms of blood pressure and heart disease, we know that people that have heart disease have a higher risk of having worse COVID symptoms, hospitalizations, have a higher risk of dying, and they have a higher risk of having long COVID. So we know that heart disease is more prevalent in the Black community. More of us die from heart disease. If you get COVID and you have heart disease, you have a higher risk of dying, have a high long COVID. So one thing we can do to protect ourselves is really making sure we're vaccinated and up to date on boosters. I had mentioned before that people that are dying now of COVID are older people, 65 and up, who do not have the latest booster. So we got to stay up to date on vaccines, make sure we get vaccinated, stay up to date on the boosters. And, we got it. I mean, that's the best we can do, because the government is about to start paying for all this funding about to get wrapped right on up. So we got to take advantage of these things now so that our people can be protected in the long term.
I got one thing, Doc, before we go.
Yeah.
I heard on the news that even after they stop giving out free testing and everything related to COVID, whatever, Moderna is still going to continue to still be free. So you can confirm that. You can confirm that. Just make sure you can do it you confirm it while we're on the air. But I did hear it on the news that Moderna is still going to continue to still give people free vaccinations.
They're probably going to do it for people. I mean, I would think they would do it for people who don't have insurance, because people who do have insurance, they're going to hit them insurance companies up for reimbursement. But for people that don't have insurance, that's the people who we worry about the most, because people they can't afford to pay out of pocket. I know Moderna, when they first started talking about how much they were going to charge, it was like $110 per vaccine, like per shot, and you got to get 2 and 3 shots sometimes. So that's a lot of money, and people that don't have insurance won't, may not be able to afford to pay that. And so I would definitely hope that they do have a plan to cover people who don't have insurance, because people that do have insurance will be protected by their insurance, and hopefully they will waive all copays. That insurance plans won't make us pay copays for COVID vaccines, because we don't do it for any other vaccines. Vaccines are considered preventative care, and under the Affordable Care Act from Obamacare, preventative care you don't pay for if you have insurance. So hopefully people that have insurance won't have copays. People who don't have insurance, the pharmaceutical industry will step up and make sure they're covered, and that will be a good thing to do.
Mm-hmm.
So thanks for letting me know. But I'm gonna look into that.
Yeah, I know you will, Doc.
I don't believe in nothing.
It's not fake news. It's not fake news, Doc.
I'm sure they have a press release about it, so I'm gonna go and see what they have said.
Okay, copy.
But thank you for letting me know that.
Mm-hmm.
All right. So speaking of COVID and heart health, we know that this month is American Heart Month, and so this month, each week, we did a heart segment, and so this is the last week of the month. So we're going to close it out with today's guest, Nurse Stacia Gray. Stacia is a mom. She's a grandmom, and she is dedicated and works with so much compassion. She's a licensed practical nurse. She has been for over 15 years.
Nice.
She's been working in the healthcare community, particularly in the Delaware County region, for over 25 years. Wow. She's worked in geriatric and rehabilitation medicine. She knows what she's doing. She got the skills to pay the bill. She's done a lot of work in cardiac evaluation and monitoring patients with heart conditions. And she really strives to be an advocate in her community and bringing attention to important health matters like heart disease. I actually met Stacia a few weeks ago because we did a COVID vaccine clinic at her church, a really nice event that she organized, health fair event that she organized for her members. And so it was really nice to meet her and talk to her. And I was like, I got a podcast.
Yeah.
I'm sure a podcast. So thank you, Stacia, for making yourself available.
That's so awesome. I'm so happy and excited to be here with you. Hoping you can hear me well now.
Yes. Yep.
Okay, great.
Yep. So just want to kick off. I know we talked a little bit about this, and which really made me want to have you on the show. But can you talk a little bit about why heart disease is so important to
you? Muted, Doc.
Because I'm talking to Bria, telling her to move away from me because she's hitting the computer, she's balling up paper, she like.
I have a Bria too.
Right.
Oh, you do have a Bria. Your Bria got her kids vaccinated at the clinic. That was amazing.
Baby girl, she was going through it too.
That was amazing. That really warmed my heart because I was waiting for people to come by. I've been hoping that people will get their first and second doses, and I hadn't seen any in a couple of months, and she came in with the kids for their first dose, and that just made my whole existence. I'm like, okay, I got to keep doing this.
Doc, where the pictures at? We ain't got the picture.
I wasn't ready. We
don't have the picture. But it's
you
fine.
have to keep doing this.
Yeah. Okay. So why is heart disease topic important to you, Stacia?
So it's so important to me because I have a brother. He was 44 years old. His name is Steven.
I think we have his picture.
Mm-hmm. And that's him. And he had high blood pressure for many years. And when he was 44 years old, he looked healthy. In fact, he would get up and run in the mornings. And he died in his sleep from hypertensive heart disease.
Wow.
And it hit me like a ton of bricks because what may have been the last day that we, all seen him, um, saw him walking into my house, and I thought, he looked a little puffy, but I didn't. It didn't register. I didn't think it out. It was a thought. I saw him like, he looked a little chubby, and that was it. But he was probably at the beginning stage of heart failure. And then when he went and got into bed, most likely he did know something was wrong, because we found the bag of medication in his car that he had just got filled, but the bag was still stapled from the pharmacy, but it was all blood pressure, it was all heart medicine.
Wow.
So the toll that the blood pressure takes on our hearts, we really, because we can't see what's going on, we have so many of us have high blood pressure. I mean, it's the leading cause of death in the United States. And heart disease is not just blood pressure. Heart disease is the leading cause of death. And in African Americans, the numbers are like crazy, just crazy. And so it's so important for us to take it serious, and it doesn't always appear that we take it serious enough. I mean, when somebody says 30% of us are more likely to die from heart disease, it should be something that we are wide awake about, that we are very concerned about. And we want to eat what we want to eat, we want to do what we want to do, and we want to live what we think is life. But unfortunately, eating what we want to eat, it just doesn't do our heart any good. And so that's why I'm very passionate about blood pressure and why it's so important. I don't want anybody to. I mean, so many, every 36 to 39 seconds, someone dies from heart disease. But some of these deaths could be prevented, and that's the goal. It's like, if I can encourage you to check your blood pressure, take your medicine, because a lot of people have medicine and they don't take it. They just say, I'm not taking that. I'm just not. I don't want that. I don't want to do that. I want to try this, and which is nothing. So that is why I am passionate about it, and I want to continue on. And in the month of February, this was the first year that I put together that heart health fair, and it will not be the last. I will continue to do it, because it is the perfect time to talk about the ways that we can improve in our health in our communities.
That's true. And I appreciate you for coming on and talking about your personal experience with your brother and heart disease. And I am totally feeling your passion to keep this going, because for a lot of us, heart disease starts with high blood pressure. Just like you said, and high blood pressure is a silent killer. People don't know that they have it. And we try to talk about this. You don't know it if you don't get your numbers checked. And for a lot of people, it's too late. You're in the hospital because you had a heart attack. So we want to do as much as we can to prevent this from killing us, because it kills our people at numbers like crazy. I'm going to try to get a chart over for Leslie to put up, because I was in the presentation last week. And in the presentation, they were talking about drugs that are used to treat heart failure, blah, blah, blah. But one of the slides, it had showed the rate of heart disease by race. And when you get to Black people, it like jumped. It jumped so high for Black men that it is like, I am so tired of looking at these statistics. We have got to do better. And it's not all on us. It's not all on us. It's not all on our habits and what we're doing. It's on the medical community too. We have to we have to address the racism within the healthcare industry that causes our health outcomes to be worse than other groups. So we have a role, and the healthcare industry has a role. And if we can get it together on both sides, I think we'll do much better. But we have to acknowledge that the healthcare industry has some racist the way that Black people are cared for within the hospitals, within the doctor's office sometimes, and it's not intentional. It's the unconscious racism that can cause these differences in care that you see between different racial groups. So the training
you will see that a lot.
I'm sorry, Stacia, what did you say?
You do see it a lot. When you work in healthcare, you see it a lot, and they really don't even realize what they're doing.
Yeah,
the decisions that they make on a daily basis, how it is racism. They don't see that until it's pointed out to them. So unfortunately, they don't want to hear it, but we have to speak up.
We do. We absolutely do. Now, can we talk a little bit about the numbers, Stacia? So we know when we're looking at blood pressure, we're usually looking at two numbers, the top number and the bottom number. Can you just explain what the differences are between those two numbers?
So the top number, that's the systolic number. That's just the systolic blood pressure. And that's the number that it gets all of the attention because it is the number that's looked at that could signify if you're having like a stroke, or if you're on your way to having a stroke, or if you're on your way to having some type of heart condition, some cardiovascular disease. So that is measuring the force of the blood flowing through your arteries when your heart beats. That's what it's measuring. That's what it's measuring. And then the bottom number is measuring when it stops, when it pauses, when it rests, rather, because it doesn't stop. It just rests. It just, your heart's just. So the bottom number is measuring the pressure or the force of the blood when your heart rests in between the beats. In between the beats. And so both of the numbers can indicate health problems. Not that the bottom number can't indicate health problems. They both indicate health problems, but the top number is really what doctors, they are very concerned about. And you did a Black History moment, and I wrote down her name, Jane Cook Wright. But I like to tell you something that about the blood pressure machines, the computerized ones. So we take blood pressures with the stethoscope and the blood pressure cuff around the arm. But it's a Black man named Michael Crosland.
Wow.
Who invented the computerized blood pressure device called the MedTech.
Wow.
MedTech 410 and 420. And we love to take blood pressures with the stethoscope and the cuff, but he invented this blood pressure machine, and they are still using these machines in different ways in the hospitals. You don't see doctors and nurses really checking your pressure with the stethoscope and the blood pressure cuff. It's an automatic thing that goes on your arm, and it puffs up and it checks the rate of your blood, the force of your blood, what's your blood doing in the arteries. So it made the monitoring of patients and monitoring of your medical conditions and the diagnosing actually of cardiovascular diseases really helpful. This was a Black man that invented that.
Wow.
And even today, a lot of people, they'll say those things don't work. It's hard not to think that that's why they say that.
Right.
Because a Black man invented it.
Wow.
Wow.
It's hard not to think
too.
that.
Yeah.
Oh, they don't work, but they use them in the hospitals.
Wow.
So, they do work. It depends on the number of things But it helps us take our blood pressures at home. You can't check your own blood pressure
Mm-hmm.
without
It's very
without that
important.
type of device,
Exactly.
and
So that
that's
was,
very important.
yeah. And
Mm.
it's saving lives. So for people that check their blood
Mhm.
pressure at home, they know their numbers. They can call their doctor and say, "Hey, my
Yep.
blood pressure is up. What should I do?" When you're not doing that, you don't know. And the next time you're gonna find out that your blood pressure up, you may be on your way to the hospital in the ambulance. And so using those devices, critical, critical. I know you sent some information about blood pressure numbers. Let's take a look at
Oh
the
yeah.
chart so you can go over the numbers and let us know what these numbers
Hmm.
mean.
Yep. So the blood pressure categories, normal blood pressure, the systolic number would be less than 120, and the diastolic would be less than 80. So 120 over 80 is normal, but
Yep.
anything over 120 over 80, 122 over 84, that's elevated blood pressure.
Yes.
And it could be from stress, it could be from different things, but it's the elevated blood pressure. And it used to be 120 over 80 used to be considered, uh, even up to 130 used to be considered normal, but that's
Hmm.
changed.
Hmm.
130 now over anything from 80 up is high blood pressure,
Hmm.
is stage one hypertension. And 140 or higher, over 90 or higher is stage two hypertension, is
Mm.
high blood pressure. And on the day of that uh, heart health fair, we checked blood pressures, and someone had a blood pressure of above 140 over
Mm.
90.
Hmm. That's
And
common.
he said, yes. And he said, yes, I didn't take my medicine.
Mm.
I didn't take my medicine. So if you have high blood pressure, you want to remember to take your medicine, and you want to be monitoring your blood pressure. But if when you monitoring your blood pressure, you ever have a blood pressure higher than 180 over 120, that's really high. That's very concerning. The
Yeah.
chart says it's hypertensive crisis, that you need to consult your doctor immediately. Yeah,
Hmm.
I would take it again. I would sit down for a few minutes and
Yep.
take it again to make sure, is that right? But I wouldn't wait too long. I would
Hmm.
call the doctor if I'm not having chest pain, or if I'm not having or any other symptoms. But if you're having symptoms, you need to call 911.
Absolutely.
Yeah.
Can we talk a little bit about what are the signs and symptoms of a heart attack? I think we also have a chart on that one too.
Okay. The heart attack warning signs. It's different for men versus women. It's like the men's heart attack symptoms are what we think of, what we think we will see. It's
Hmm.
chest pain. It's pain in the jaw or pain in the neck. It's even back pain, arm pain, or shoulder pain. My father had a massive heart attack. He was 44 also. I know it's a wild story.
Wow.
It's a wild story because two of my siblings and my father, they all died at the age of 44. But
Mm.
praise the Lord, I am 46 years old and I was next in line.
Mm.
So
Mm. Mm.
I'm over that hump.
Hmm.
But the chest pain, the pain in the neck, the jaw, the shoulder, and the shortness of breath and the nausea and vomiting are something that we're all familiar with. Like, these are signs that you're having something is definitely wrong. You see that in men and women, but in women there are some signs that are, you may not even, you may not have shortness of breath or chest pain. You might just be lightheaded. You might feel very tired all of a sudden, or you might have indigestion, that that feeling like you ate something and it's sitting there. It's something sitting on your heart.
Like that
Might feel like you're
heartburn.
fainting,
Hmm.
like a heartburn. Yeah, yeah, yeah. So these signs are, we have to be mindful of them because they're subtle, and it's a someone from my church who just had um she went into cardiac arrest,
Mm.
and her fiance was with her. She survived this thing, but had she not been with someone, she may not have survived because he began CPR.
Wow. CPR, that's
But
another thing that's so important.
Wow.
CPR, yeah, he began CPR. He called 911 and began CPR. And Kia is young, and Kia is alive and well, on her way to recovering. I mean, it's a long road, it's a
Yeah.
long recovery, but um, just knowing that, she just woke up. She had just woke up and stood up and fell back down. So that's what I mean, like paying attention to what's going on around us. Also,
Right.
it's
Wow.
just like, you just never know.
So
You
Stacia,
just never know.
how important is the diet? Like, and,
Oh,
and and according to like even age factor, like how does that like go along together, like, to this disease?
so that's why it's important for us to um, not only get our blood pressure, make sure they check your blood pressure when you go to the doctor,
Mm-hmm.
but checking it at home, especially when you have high blood pressure already, because then your doctor will tell you the different lifestyle changes you need to make.
Right.
You need to you may need to incorporate some more exercise. You may need to lay off some foods, especially the salt foods. I mean, we love salt, but especially the salty
Yeah.
foods. I mean, there are some foods that help lower blood pressure, and it's like tomatoes and tomato product. Foods. They are very beneficial in helping to lower your blood pressure. Citrus and celery and, carrots and fruits and vegetables, that kind of stuff that we don't really, well, I love it because I don't eat meat anymore, but, you know,
Right.
um, you certain grains and nuts and berries are very good things to eat to help keep your blood pressure balanced. Beans
Mhm.
and lentils and things like that. I mean, it's health foods, foods that are going to help you improve your health. Even broccoli and yogurt and, you know, um, flax seeds. Everybody got to know about flaxseed, chai and flax seeds years ago, and so everybody like sprinkles that in their oatmeal. And we know oatmeal is a big heart health, and oats are a big heart health food that can help reduce your blood pressure,
Mm-hmm.
help keep your help keeps your vessels relaxed. So that's what we want. We don't want our blood vessels to get clogged up with fat.
So what foods would you say is against, like, should we chill on, like, or just relax, especially with our folks? We love us some macaroni and cheese, we love some fried chicken,
Yeah,
collard greens, like you said, we heavy on the seasonings.
yeah,
It's part of our culture.
That's true.
it is.
I mean, and it's just the truth. Anytime you have an event, you could definitely see one of those three things there. It's just that simple.
You know,
And then, I kind of think that the event, like the once in a while type of thing, is okay. Like you can
yeah, in
indulge.
moderation.
It's the
In moderation.
everyday that's the problem. Like the everyday consuming processed foods. A lot of it is not really the salt that you add to your food. It's the salt that comes with the food that the manufacturer put in the food to make it taste a certain way. So
Mhm.
reading
Hmm.
the labels and looking at how much salt is in it before you even open up the package
No, I'm on.
is really important.
It is. But you know what? in our communities, it breaks my heart sometimes to see that we don't have fresh grocery markets.
Mm-hmm.
We have corner stores, and they're filled with canned foods, which are processed meat,
Yeah.
and they are have a lot of preservatives in them. It's
Yeah.
not good for us, and it's not good for our kids. And this is the part that um is racism. It
And
takes down,
structure.
it can take down a whole community
Mm-hmm.
because the fried foods that we eat, it's available at the corner stores.
Mm-hmm.
French fries, yeah, we can eat this chicken strips and you can eat it, but some people are eating this every day,
Yeah.
loading it with
Yeah.
cheese, fatty meats, and the processed meats, the lunch meats, the hoagies, the bacon, the hot dogs.
Yeah.
Stop.
We gotta like, and it's not about like getting rid of it altogether because it's hard to change habits. It's
Yeah,
about
yes, it is.
slowly cutting
Cutting
back,
back.
choosing one thing,
Mhm.
and maybe instead of eating it every day, you eat it 4 days a week instead of 6 days a week. So just like
There you
slowly
go.
cutting back and making behavior changes slowly. It has to be easy because if it's too hard, you're not going to do it, and you'll stop for a couple days, but then you'll hop right back on it. So
Right.
behavior change is a very slow process. You got to make it easy for yourself. But Stacia, I know you have to get ready to go. Wanted to
I'm
thank
sorry,
you
I
for
do.
coming on and sharing your passion with
Yeah,
us. We'll definitely have you back on and look forward to doing and collaborating together more in the future.
definitely.
Thank you
Thank you,
so
Stacey.
much. I had a great time. And everyone, just start to take care of yourself. Just start thinking about your heart. You can't see your heart, it's on the inside, but it means the world to you. It should mean the
Mm-hmm.
world to you. If it
Mm-hmm.
stops working, you stop working.
Right.
Mm. That's the
Right.
truth.
That's true. Wow.
That is the truth.
Wow.
So I know all those French fries look great, but try a salad sometime. Just try it.
Or a small fry.
Yeah, I
Yeah.
need to hear that. You fine.
Just cut it down a little
Right.
bit. It's tough.
Wow.
Yes, yes,
But
yes,
thanks so
yes,
much,
yes.
Stacia.
Thank you,
You're
Stacey.
so welcome. Good night.
All
Well,
right.
good day. Have a
Right.
good day,
Right.
rather.
We'll see you.
All right. Have a good
Okay.
one.
All right, so let's hop into some news real quick. Just piggybacking on what Stacia had mentioned about us not eating enough vegetables. I had heard a news report that speak that children are really not eating enough vegetables. They're drinking too much sugary beverages. In fact, they said that the pediatricians recommend that kids only consume about 6 teaspoons of added sugar a day, and 1 can of soda has 10 teaspoons in it. So if they're drinking 1 can of soda, they're already drinking twice as much as they should be drinking in a day just from the soda, not including any other snacks and whatever else they're eating. And that's contributing to the diseases that we are starting to see, that we have been seeing in kids that we hadn't seen in previous years, like the high blood pressure, the obesity, the diabetes that kids are having now. It's a lot of it is about what they're eating.
Wow.
G, what you feed your grandkids?
McDonald's. I mean,
Listen, I mean, but that's real though. That's
right,
real. And
right.
so,
I
but
always
I
treat
like
it
to,
to McDonald's. I
it,
mean,
but like a treat is not a big deal. If she's
right,
eating that every day, that may not be the best thing for her. But a treat to McDonald's, like periodically, is not going to be the cause of her demise.
right,
Every day McDonald's, we may want to look at, well, what are we choosing to eat at McDonald's? Can we choose some healthier options? If that's what you got to eat because you just don't have time to cook, then that's what you got to eat. But can you choose some healthier menu options that may promote her health?
right.
And
That's
we
true.
don't want to kill our kids,
No,
clearly, but we have to figure out, what can we do to meet our needs? Like, I don't have time to cook and I need to go to McDonald's. What do they have that may be healthier?
that makes sense. I mean, I just know as the generations changed, most of the women, they started working. So
Yeah.
back in the day, a lot of women was staying home. They was
Yeah.
cooking. It was well-rounded meals, but each generation, the women started elevating to the point where they was contributing. They was like one of the major financial factors in the household.
Yeah.
So the dynamics of the household changed. So a lot of fast food kicked in, a lot of microwave products,
Yep.
Processed foods. All these things is a part of the regular everyday lifestyle of food or way of living. So
that's true.
It wasn't like maybe back in the day, like maybe the 60s, 70s, even maybe the 80s, early 90s. Now it's like both parents are working.
Everybody working. Who got
right.
time to cook? I don't got time to cook.
Right. So when we come home, throw that in the microwave. Now it's in the air fryer.
Yeah.
Whatever the case may be.
Yeah.
So we're getting away from more healthy style lifestyles and healthy style food, choices, and just quick fixes to whatever the situation is.
That's true. And it kind of makes me think about what Dr. Wall said, and I'm gonna always go back to this. It's about having a plan. When you don't have a plan, you just gonna just be living dilly-dally, and you're not gonna make the best decision. You're gonna make the easiest decision.
Right.
And so what I like to do is bring our friend Stacy Woodson on. She's a dietitian that's come on a few times to talk about, what can parents do to better plan their meals so that we're not like always relying on processed food and fast foods to feed our families, because it's easy and we're just going to do what's easy, because who has time to go after the hard thing? I don't have time for that.
Or come home and make a 4-course meal.
That's definitely not going to happen.
After working 8, 9, 10 hours a day. So, I mean.
Even on my day off, I'm not making no food. If I'm off, I'm definitely not cooking because I just want to be off.
Right.
So when am I going to cook?
Right.
It's just hard. It is really, really hard. But I also want to mention that flu levels are trending downward, which is great. They're trending downward across the country. They're trending downward in Pennsylvania. The latest looks like Delaware County may be looking good. I can't tell the trend, but I can just tell in Pennsylvania in general, the cases of the flu have been coming down, which is great. Now, I do know that Delaware County had about 6,000 cases of flu since October. There was a lot of flu that went around, and about 110 people died from the flu this year. So we just want to encourage people to remember flu vaccines work. They help protect your body so that if you get exposed to the flu, you won't get as sick. You won't end up in the hospital. It's the same thing we expect COVID vaccines to do. So you can still get the flu, but you just won't get as sick as you would if you didn't have any protection at all.
Right.
So just want to remind you all to make sure you're up to date on all your vaccine levels. G, you got your flu shot this year for the first time. How you feel?
I sure did. I've been feeling good. I can honestly say I didn't get a cold. My wife's sick now, and I'm good.
Oh, tell Tracy to get better. Don't be doing that. Tell her to get better.
I turn my head like it's you got to cough. Just to cough.
Cough in your elbow. Cough in your elbow.
It's not like that. So
hopefully she feels better.
Nah, she's doing good though. She's doing better.
Okay.
But she didn't get her flu shot though. See, I told her to get her flu shot. See, it's like there's certain things that as you start to get older, you have to start incorporating into your lifestyle.
Sure.
Maybe when you was younger, you didn't feel like you had to, but these things help.
They do. Help. Yeah. Come on, street practitioner, tell them.
Yes, I can honestly say they help. Yeah. You see how I took it. I took it like a G.
You did. Good job. Yeah. The other thing that came up is the CDC added COVID vaccines as recommended vaccines for kids and for adults. So it's now a part of like the recommended schedule. This does not mean that it's required to go to school or it's required for anything, because the states actually determine what vaccines are required for kids to go to school. The CDC just puts out the recommendations. So I think that's a good movement in the right direction. If people aren't sure what to do, do you really need to get it? It's being recommended by the CDC. They are the agency that's monitoring everything in terms of public health. And so if something comes up, if there are problems, the CDC is going to point it out. They're going to let us know what to do next. I I may not have faith in 100% of the government in the U.S., but the CDC, I feel, has a track record of doing the best they can in getting information to the public. So I rely on them for a lot of information that I share.
Right. I mean, it makes sense. And I feel like COVID probably made things more serious for people. So now the CDC is on everything smoking.
Yeah.
Anything that come up, any information they can give us, I feel as though like they just a reliable source. We never talked about the CDC that much before COVID.
No, we didn't have to.
So now it's pretty much in our everyday conversation. So especially for anybody in the medical positions and physicians and doctors like yourself, like you talk about the CDC on a regular basis.
Yeah, absolutely.
Yeah.
This is the same group that said, get the chickenpox.
Right.
Get the chickenpox vaccine. And because of that, we're not talking about chickenpox. It's the same, group that tells us when to get a tetanus vaccine and when to get the measles and the monkey, and who to get the monkeypox. It wasn't for everybody. Everybody didn't need to get a monkeypox vaccine. And so it wasn't recommended that everyone get it. But people who were high risk, the CDC identified and say, high risk people, make sure you protect yourself and get a monkeypox vaccine. So
we don't barely even hear about monkeypox anymore.
No, we haven't.
Not like we did. Not the cases that was driving in and soaring in.
Yep.
So now we rarely hear about monkeypox.
I think cases are way down, which is good, and that's what vaccines do.
Right.
Vaccines and public education, teaching people about how diseases are spread so that they can change their behaviors. That is the kind of stuff that cuts down on infections like monkeypox and COVID and flu and RSV and all that stuff from spreading. But that's all I heard in the news. I mean, I was on vacation for a couple of days, so I wasn't really like tuned into my news sources, but that's what I picked up. That's what I picked up. All right, good. Right. Our next clinic is going to be in Marcus Hook on Saturday, March 18th from 1 to 3. We're going to be at the firehouse. We're doing education and vaccines. We're playing bingo. It's going to be a fun event. So come out there. Oh, yeah. I don't think we have anything else.
I think I'm signing autographs that day too, Doc.
G signing autographs. So come in and get your t-shirts and your calendar signed.
I'm signing autographs.
Come through and get your signatures. We'll make sure that we keep the line in order. But that's all I got. So everybody, thanks so much for tuning in, G. Thanks for your always insightful and your Black History moment coming through.
I'm trying to get better, but thank you, Doc.
You're doing good. You're doing good. All right, everybody. Thanks for tuning in. And we will see y'all next week right here on cmpradio.net, Wednesday at 12:15.
All right, everybody. Have a good one.
See ya.
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.